Greetings to all my fellow surgeons and dear colleagues. Hi, this is Dr. Simanchal Goel, and today we'll be touching a very important topic for beginner surgeons, that is 9 secrets to a clear cornea after a phaco surgery. So, in these 9 pictographs, you're going to see the pictures that I have drawn by myself, and you won't find these tips and tricks in any of the textbooks. I have studied them, I have operated a lot of cases, and all these 9 techniques are out of my own experience. You might have heard about these and you must be practicing these techniques, but I thought it would be a good idea of inculcating all these tips and tricks in a single video, especially for trainee surgeons who lack the insight of the importance of these techniques to a clear cornea. So, coming to the first tip, number 1, that is endothelial coat. So, as you can see this pictograph, you can see the sky blue cornea and the layer of dispersive viscoelastic which absorbs the heat and the ultrasonic energy released from a phaco. So, tip number 1 is very important, and all of you must be knowing, and always remember to coat the endothelium with the dispersive viscoelastic. Tip number 2 is the phaco plane. The phaco plane, the plane on which you phacoemulsify most of the parts of the human lens, that is the quadrant removal mode, should be at the level of iris. If you draw an imaginary line in your mind while you are doing your phaco, always phacoemulsify at the plane of iris. I have noticed from my experience that every millimeters you come above the plane of iris and near the corneal endothelium, you are going to experience a lot of corneal edema. Always try to phaco at the plane of iris. Tip number 3, the preferred phaco. A lot of you must not be knowing what a torsional phaco is, especially in your residency days if you did not have your hands on an Alcon machine. Some latest generation Alcon machines like Centurion and Legion currently use torsional phaco energy with longitudinal. So in a longitudinal phaco energy, there is a jackhammer movement of the tip of the phaco, and in torsional, there is an elliptical movement of the phaco tip. If you don't know what a torsional phaco is, kindly Google it and read the literature. Torsional phaco systems are known to cause less heat production and less free radical generation, thereby decreasing the chances of corneal edema. If you happen to have a torsional system, go use it. Tip number 4, the preferred phaco mode. As you all surgeons must be knowing, there are 3 phaco modes currently in our phaco machines, that is pulse, burst and continuous. For me, pulse is the way to go. In pulse, what happens is the phaco machine uses 50%. The phaco machine uses energy for 50% of the time. 50% it is off and 50% time it is on. So you cut short the release of energy by 50 damn percent while using the pulse mode. For those asymptomatic, for those 90% of the cataract that you're going to get, the pulse mode is the way to go, decreasing the chances of corneal endothelium. For corneal edema, pardon me. Tip number 5, preferred phaco energy. For routine cases that are nuclear sclerosis grade 2 and grade 3, for 90% of the cases, I keep my phaco energy at 30%. And as the grade increases, I keep on increasing the phaco power. If the grade is grade 4 and even grade 5 brunescent cataracts, I use power not more than 60 or 70. I switch the mode to continuous mode, but I never use the power at 80, 90 or even 100%. Some surgeons I have seen, some of my colleagues used to use 100%. The corneas won't tell you the next day, but these patients land up in PBK later on in their lives. Always use 30 to 50% of the power. Point number 6, preferred irrigating solution. This is a secret to a clear cornea that a lot of people don't know. A lot of friends of mine are in the habit of using RLs, Ringer's lactate and normal saline in place of their irrigating fluid. What I have noticed in some standard textbooks when I was a resident, I read it in one of the textbooks that balanced salt solution contains usually a chemical known as glutathione. It's an antioxidant by nature, and what it does is it chelates, it engulfs and binds with the free oxygen radicals usually generated during a successful phaco. While you're phacoemulsifying, you don't know you're creating a lot of oxygen free radicals. And what a glutathione molecule does is, as you can see in this picture, it binds with the oxygen free radical that injure endothelium, and that results in clear corneas on postoperative day 1. This is a very important trick. You can screenshot, you can share your screens, and you can save this image for giving it to your juniors. And that's it. Coming to the tip number 7, energy release. I never noticed the importance of this technique since till the time I performed around, I guess, 5 or 6,000 surgeries. I learned the importance of this trick a little late, which I don't want should happen to you all. Energy release is very important, and it should only happen in the core of the nuclear fragment. Always try not to use phaco energy when half of your tip is buried in the phaco fragment and half is empty in the anterior chamber. Use the iris plane and try to release maximum phaco energy in the core of the nuclear fragment. The 8th tip, which is obvious and which you all must be knowing. In denser cataracts, I even visco coat the endothelium 4 or even 5 times in those hard brown cataracts. Do not hesitate to use dispersive viscoelastic repeatedly in hard cataracts. It is always said that endothelial cell count is far more expensive than your time and 1 ampule of dispersive viscoelastic. Use dispersive OVD repeatedly in hard cataracts. And the last tip, a golden rule: do not hurry. Take time. Take it easy in your early learning days. Take time, never hurry to operate those hard cataracts. 5 extra minutes spent by you on a successful surgery is going to pay dividends to the patient. Especially in those post-operative visits, the patient is going to come to you with a smile and with a clear cornea. And yes, a vision of 6x6. That's all from my side. I hope you like my videos. This video has been a little late because I've been really busy for the past couple of weeks. Nevertheless, I guess this video will help you all in your careers, in your surgical careers. Kindly like, share and subscribe. This is Dr. Simanchal Goyal signing off. Have a great day ahead. Thank you. Bye bye.